The nasal septum is a wall that exists between the right and left side of the nasal cavity and divides it in half. It consists of bone and cartilage. Oftentimes, the nasal septum can be deviated. Oftentimes, this deviated septum will cause some nasal obstruction, which then prompts a patient to come in and see us. In order to fix a deviated septum, a patient undergoes a procedure called a septoplasty. During a septoplasty, what an ENT provider will generally do is we make a small incision inside the nostril of the nose. No external incisions are made. There's no external changes to the size, shape, appearance of the nose during septoplasty surgery. And what we're doing during that procedure is we're dissecting out all of the bone and cartilage. Once we get everything nice and isolated, we're then able to recontour and then relocate the area of that nasal septum to a more midline position so that you can have proper nasal breathing on both sides. Oftentimes people are unclear whether or not they're good candidates for septoplasty, and sometimes it can be hard to know even if you have a deviated septum to begin with. Some of the telltale signs of deviated septums are mouth breathing, nasal congestion that ends up being worse on one side in comparison to the other, and oftentimes disrupted sleep. One of the most common questions we get here at Capital ENT and Sinus Center is septoplasty an effective surgery for snoring? That's a more complicated question to answer. It really kind of depends on what the underlying anatomical makeup of the individual is. The short answer is, if you have a significantly deviated septum that's causing you to do a lot of mouth breathing at nighttime, definitely deviated septum repair can help snoring in that situation. You know, deviated septum repair can be as easy as a 15-minute procedure or a 45-minute procedure. It really just depends on how significant the anatomical abnormality is. If you have really deviated septum, it's going to take a little while, but we just like to take our time and make sure we get the job done right. If you've had long-term difficulties breathing through your nose, come see the nasal and sinus experts at Capital ENT and Sinus Center so we can help you achieve the nasal breathing that you're looking for.